Hi, this is Dr. Lenore Coleman, President and founder of Healing Our Village, and I want to welcome you today to For Your Health. We're excited to be here. I'm coming to you out of Atlanta, Georgia, Jonesboro, Georgia, and the sun is shining and the skies are blue, which makes me very happy. So thanks again for tuning in today. As you know, For Your Health talks about all the various health conditions and health disparities that we're seeing in our country, especially among people who are African American. Last month was March. That was Kidney Month. So we have a number of our shows are up on our website, HOVHealth.com, under Video on Demand, where we talked about chronic kidney disease. And April is actually Health Disparities Month. And so this month I'm going to be bringing a whole variety of topics that I think you guys will be interested in, so that you can just learn more about some of the new things that we have out there, as well as some of the diseases that are affecting us as African Americans. And today, for our first episode here in April, we have Dr. Marilyn Corder, who is a pediatrician and geneticist, a friend and colleague of mine. I used to be in the DMV, and so when I was there, Dr. Corder and I had a radio talk show called Village Talk, and she still is on that show. So if you guys want to talk to Dr. Corder and listen to her on her show on Saturdays, I'm going to have her talk about that. But today, we're going to talk about CBD. A number of you out there may be using CBD, you may have heard of it, you may be tempted to try it. And so we're going to talk about some of the medical reasons and some of the medical benefits of CBD. And it just so happens that Dr. Corder is intimately involved in this. She was involved in a lot of the research. She knows all the ins and outs, and actually using it on patients in her practice. Some of her patients, young patients, are using this product. So Dr. Corder, thank you so much for coming and talking to us today. How you doing?
First of all, I want to thank you. I am honored to be on your show. Of course, as you say, we are close associates. You are one of my dear friends. I respect all that you do. We miss you. I know you're in Atlanta. That's it. That's the DMV's loss and your and ATL's gain. But you always right here. We do the Village Talk thanks to you continuously. You know, as we always say, knowledge is power. And I'm so excited about what the topic, because I've been a physician now for over 42 years, trained there at Proud Howard University Medical School. And, you know, right now we're still in the pandemic, and that pandemic it's going to last a lot longer than what we initially thought, unfortunately. And because of that long duration, we're seeing more and more of people of color dying, morbidity and mortality, the disproportionate from health situations from people of color, we see more and more, and there's a larger gap. Now, I'm excited about CBD because so many people have been addicted to pain medicines, opioids, narcotics, and the more they take, the more they needed to take, and then some, and have died and have become addicted and have gone to prison, and all that leads to.
Yeah.
Certainly, I am a pediatrician, because people are like, well, wait a minute. And I've never, ever written opioids. I've never used my DEA to write for that, but I see people in pain. And even the overusage of Motrin, which is ibuprofen, Tylenol, etc., we don't need that as well, because that attacks your liver and your kidneys. So when I got excited when CBD became legal. First of all, CBD is legal. We're not talking marijuana, even though in many places recreational and medical marijuana is legal as well.
Yeah.
But CBD is legal, and it's natural, and it's derived from the hemp plant. And we have seen remarkable improvements in the anti-inflammatory categories, such as pain relief, from the topical sprays to the creams to the rubs and all of that. There are lots of CBD companies, and I will say all CBD is not equal, but there are a lot of good ones. I'm going to be talking about ours, and I'll be making sure that I give you the website as well as even my email.
Yeah.
But if you're already on CBD products and you getting relief, etc., then continue. If you're not, I welcome you to begin to try ours out.
Yeah.
We will have a special because Dr. Coleman, Healing Our Village is so near and dear to me, but we'll be running a special, and I'll show you how to put that code in as you browse through the variety of the CBD items that we have.
Yeah, so a couple things I just want to comment on. So everybody I know, I think, is keeping somewhat track of the George Floyd trial.
Yes.
And we found out this week that he had chronic pain. He had chronic
Yes.
back pain. And so he was on his medication, opioids, you mentioned that, for the management
Yes.
of his chronic pain. So now that is how the defense is going to try to make this thing more complicated, because he had those meds in his body when he was assaulted.
Right.
So this chronic pain and this using hip pain, back pain, opioid use, all of that really makes things super, super complicated. So having a natural way to deal with the inflammation and the pain is a big deal. But I also want to talk about this thing you just mentioned, which is CBD is legal. Either you have no idea. Well, you do. You do, because some of your patients are actually have gone through this. How many millennials, how many young adults, teenagers, have got arrest records, been pulled over by the police because of marijuana?
Right.
And
Yeah.
that is not legal. And this is a real problem for us as a community, because a lot of the people who are using it for some of the benefits that CBD actually has, and it is legal.
Right.
Right now, I have 2 or 3 young adults. These are people who are 25 to 30 who can't get jobs because they can't pass a drug test because they use marijuana. So I wanted to talk about some of that too as we're talking about CBD. I'm a real proponent of CBD. So if you're using it because of pain, but we're going to talk about all the medical conditions that people can use it for, and you can still get a real job where they drug test. You don't have to worry about that because it's legal. So I just wanted to throw that out there, right, in terms of just talking about CBD. But, the question is why do you think it works for so many different things? We talk about epilepsy, we talk about pain, we talk about sleep, we talk about, this thing works for everything. Why do you
It's
think
like,
that is?
and so many people will be like, oh, but how can it do this and then do that? Well, first, let me go back to the concern I also share in terms of the legal system, in terms of so many young people have been locked up for marijuana use. And as a previous medical director of corrections, juvenile corrections here in the DMV, I saw tons of, and I call it wrongful arrest and wrongful being locked up and incarceration. And of course, they were young blacks. And many of them were taking marijuana for several things. It's almost like self-medicating because and I know because CBD also, well, marijuana cuts down on stress, helps your mood. And it also, many people who don't realize have something called ADHD. And unfortunately, we see tons of ADHD individuals being impulsive, making wrong decisions, not thought through, get in trouble. Well, many of them have taken, as they tell me, I don't want Ritalin, understandably. So I use weed to keep me focused, keep me calm. And it does that. And they realize that. And as they realize that, they've been using it. But they get in trouble. And they have been. Now that we are realizing, we should have done it a long time ago, that these were minor crimes and not even should not have been criminal in it, in terms of that category. Folks are able to recreational use or medically use something as natural as marijuana. Now we're talking CBD, and you're right. So the component of marijuana has a little CBD in it. But now we have pure CBD that is isolated out and doesn't have THC. Right. And as a physician, that's where I am, and I'm excited about that because now we can have individuals benefit from CBD. And those conditions, as we talked about, not only just, it helps your mood, it helps your stress, It helps pain. And again, that's why I got excited, because I have lots of athletes or just injuries or post-op, even the mothers who are right after the delivery, a lot of times they're given opioids and a wisdom teeth extraction and they're breastfeeding. I'm like, no, 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 let's do something natural. So we'll have the pain rub, okay, topical rub. We'll have the spray, or even something, the drops. And they get relief without the side effects of having a sleepy baby, or even themselves having to go in a higher dosage. It is definitely good for ADHD and ADD, which are your attention deficit hyperactive disorders. Many people have that. Grown-ups have it and don't realize it. They've accommodated for it, etc., because it is hereditary. But it's a good thing if you're taking something natural for it, because again, your creativity, you're not using something that's going to drug you down, but increase your heightened cognitive ability as well as your creativity, and allow you to have organized thoughts in general. While we're on the same neurological positive, because I'm going to go head to toe if I may.
Yes, please.
While we're on the neurological benefits of CBD, we now know, and I'm also a geneticist, that it also helps with autism. Now, we know there's a spectrum of autism, and nothing for over the years has been anything to say take. We have resources, we have I call it directives and educational modules for a child or person with autism, no matter where he or she is on the spectrum. But now we've seen in many studies that CBD drops has shown major benefit in a brain that is autistic. So that's certainly something I'm excited about as a pediatrician.
Yeah.
We also know that it has been beneficial in seizure management. Now, I am not saying, for the record, that you come off all your medication, but what it begins to do, and we have seen over and over, as folks are on whatever the medicine, let's say for seizures, it allows them to be seizure-free longer as well. It doesn't interfere with those medicines, and sometimes, in many cases, they've weaned them off of the prescription medicine and benefited just by and in my practice, we've seen it benefited just with the CBD drops.
Yeah, one of the things to mention,
on.
Yeah, just to mention, throw in that into the seizures, the fact that you're able to even decrease the dose that you're using is good, because seizure medications have a lot of side effects. And so if you're able to decrease the dose because you're controlling that seizure threshold with the CBD, that's also good. Even if you don't come off, taking smaller amounts is a good thing.
Well, I personally had a phone call about 3 weeks ago from one of my mothers. Her son was taking a high dose as they wean up on seizure medications as standard. And she said now he's flunking. He's gone from straight A's. He's apathetic. There's no energy. He's sad. And we know there are some side effects, as we just said, about seizure medications. So I said, well, let's do this. Let's put him on the CBD drops and gradually wean down to the half dose that he initially was on. And she's excited. She's like, he's back, seizure free. He's still on a little bit of the, as you know, as a pharmacist, medication for seizures can drain you, as you're seizure free, but can drain you. So it's a win-win combination with her.
Yes.
You asked the question of why does it appear to do so many different things? And that is because we have multiple endocannabinoid receptors in our bodies from head to toe. And as we started out with seizures, headaches, migraine, it benefits, we see benefits, ADHD, autism, but also in the senior population. I'm so excited to mention that there are many of my friends taking care of their parents, and many a time between Alzheimer's and dementia and just being old and forgetful, and I call it the cobwebs of the brain, we found that the CBD drops, even though we know there are other prescriptions that folks are putting in placed on, but sometimes that even worsens or makes them more groggy or makes them sleep and less alert. Well, many of my friends and clinicians have started patients on the CBD drops, and their loved ones are doing better during the day, more alert, increased cognitive ability, happier, and even some of the sleep gummies and sleep tea allows them to sleep peacefully, and it reverses and this doesn't allow the advancement of the brain neuropathology. So I'm excited. So I'm talking now from little ones all the way to 99 and then some.
Yeah. So a couple of things just to share. So, because I try to, I get into personal stories as well.
Right,
So,
right.
because I've been doing this for, you said 42 years. I've been doing it for the same long time. I've been seeing a
I
lot
know.
of people over a lot of years. So, a couple things. Number one, there's a lot of moms out there, a lot of people out there that have bipolar disease. And they think that they have bipolar disease because of whatever. Well, they might have bipolar disease because they're smoking marijuana that's been laced with we don't know what.
Right.
And if they came off the marijuana, they would actually find that they don't have bipolar disease no more. And they don't need any other medications for bipolar disease. And I know this to be a fact because I know personally someone where that's their story. The other thing I wanted to say is for your seniors. My brother went through a big issue between October and now. He fell in his apartment, dislocated his hip, had to go to 2 weeks in the hospital where I had to fight with folks. 2 weeks in a skilled nursing facility where I had to fight with folks. And the reason I had to fight is because these places like to put our seniors on what I call chemical restraints.
Right.
So
Oh,
if
yeah.
that person is a little agitated or not sleeping well or whatever, the first thing they do is sedate them.
Yes.
Especially if they're in assisted living or skilled nursing because they don't want to be bothered with them. CBD is a great alternative for that. And
Absolutely.
so I think I'm so glad you mentioned that because that's a big deal.
And I take CBD because I'm trying to ward off those times of down the road with my brain aging every day between stress, mood, anxiety. And I take it to keep my brain cells, to keep those synapses young and working effectively. It's almost like your carburetors and your spark plugs not coordinating. And I just take it preventively. I think preventive medicine is the best medicine, and I say that all the time. um, and we have endocannabinoid systems every place, from our brain all the way cardiovascular, all the way down to our feet. But one of the specialists that started using, seeing benefits other than the neurologists in terms of seizures is the GI docs, the gastroenterologists.
Okay.
And we've seen over and over inflammatory IBS, inflammatory bowel syndrome, colitis, ulcerative colitis, and Crohn's disease patients benefit from CBD. And I know I have patients that have come off of the strong medications such as methotrexate, and they're taking CBD, and their gastroenterologists are like, wow, we don't see the inflammation anymore, because it's a major anti-inflammatory. For those who don't understand what that is, anti-inflammatory means it's anti-pain. It cuts down on the pain and inflammation that we see in many conditions: post-op, arthritis, colitis, rheumatoid arthritis, all of those inflammatory conditions that we see, autoimmune, such as lupus, such as even Parkinsonism. Go back to the brain. When you have the shakes, etc., we've seen major improvement. And it's not, and I'm not going to say it's a cure-all, but I will say this: there are thousands of studies, and I can go through the studies. That's a whole nother show, that have shown the benefit, and everyone is individualized. But even trying it won't hurt.
Yeah.
And many people, as they have tried it, they realize, wow, I'm feeling better. I've had folks who children have come off of the Ritalin and gone on CBD drops, and they're feeling much better. This is for ADHD. They're feeling much better. The parents are excited. The siblings are excited, and all of the above.
Yeah, and talk to us about being addicted. So this is not something that
Right.
you can be. It's not like
Right.
marijuana. Yes,
Sorry for the phone. Right.
that's okay.
Exactly. And it's not. You can drink. I mean, you can drink the whole bottle. You may get a little GI upset, if at all, but you're not. It's not an overdose. You don't get addicted. You just get improvement. One of my colleagues, we were talking about what's the side effects of CBD. Better health. Now, there are 2 or 3 things that you want to make sure as you check with your doctor. But most people have started taking and call their doctor and say, "I'm feeling great. Do you know about CBD?" You know, but you don't want to take it if you're on a blood thinner. And
Okay.
unfortunately, between the COVID and just in general, many people are throwing blood clots, etc. And they're on blood thinners. And if you're on a blood thinner, you don't want to take CBD because what CBD does, it prevents clots. It helps your homeostasis of your of your blood flow, not clots. So if you're already on one, hopefully you're not, but so you won't have to be on if you're taking CBD, but you don't want to be on that because you don't want to bleed out. All right. So that's one contraindication. So
Yeah.
we don't want that.
Yeah.
So inflammation, anti-inflammation is important prior to being on tons of medication. I've had folks, even with diabetes, and we have weight loss improvement with CBD. I've had folks with decreased their hemoglobin A1C, and I smile when I say that because you are the diabetic guru, education-wise as well. I had folks have hemoglobin A1Cs in teens, and whatever they're taking, they're still taking, and they start CBD, and then their hemoglobin A1Cs begins to go down as their doctors are eliminating and decreasing their medication, which gets me, I'm excited when I see that and experience that. So I'm impressed, and I feel that in terms of the benefit of CBD, but I feel that after it took this long, 40 years in my practice, but decades and decades, and we know politically why we don't, it was reasons why there was pushback for bringing CBD to the market. We know that.
Right.
Big pharma, okay, I'm gonna say, but
Yeah,
now it's out.
they haven't figured out a
And
way to be able to make it work for
absolutely.
them, so that's
And
been an
people
issue.
can now take, that's right. And with this COVID, with the pandemic, you often can't even see your doctor like you would. And now it's a time for folks to take their health a little bit more seriously and understand the side effects of the medications,
Yeah.
of other medications, because every other commercial, we see a new medication and we listen to it and say, ask your doctor to prescribe it. But please make sure you turn the volume up of those commercials, because towards the end, they start giving you a list of the side effects.
Exactly.
And each and every one of those side effects can lead to problems and even death. And it will say even death. So I'm like, why are you going to ask your doctor to give you something that may kill you? I get it. I understand the conditions. But also, let's think about lifestyle changes,
Right.
certainly,
Yeah.
as well as some natural things, certainly.
Right, exactly. I think that's so important. I am a pharmacist, as you know, by training, certified
Yes,
diabetes educator. But I believe in natural remedies. Okay, they've been around for thousands of years, and
exactly.
some of them work really well. As you know, I travel all over the world. Jamaica actually has in their pharmacy school, they have a whole department that's just focused on herbal and other types of non-traditional remedies, right?
Exactly.
Plant-based
Exactly.
remedies. So this stuff, I never say to anyone that, don't do that. That's not true. What I always do is look at the research, look at the data. If the data's there that says that it has benefit, it does. And the CBD research is there. No doubt about it. I did a deep dive into a lot of the articles related to its ability to decrease blood sugar, decrease high blood pressure, and it's that inflammation I think is the key. And they're continuing to do the research. But what people don't know is if you're overweight, if you're obese, your body is in a state of inflammation. Inflammation is swelling. People think about swelling. Well, that's what that means. All of the organs and all of the nerve fibers and all of the different things that are happening in your body is affected by this inflammation. There are actually factors that float around in your bloodstream that cause this inflammation. And so if you can decrease that inflammation, a lot of the disease states where that plays a role, those disease states get better. And so that is why I think we're seeing so much of that type of thing. Listen, we're going to take a short break. Short break. I
Okay.
like my folks while they're watching to get up and move around a little bit, go get some tea and some green tea. As you know, we sell the green tea as part of our health food offerings. So we're going to come right back. Don't go anywhere, Dr. Corder, because I still have a few more
I will.
questions to ask. All right, we're going to take a real quick break.
Epigallocatechin gallate, superoxide dismutase, glutathione peroxidase. Now, those are names you probably aren't familiar with, but you should be. Those are antioxidants known to fight free radicals. In fact, did you know that some viruses are actually alcohol resistant? One major study showed that by adding the epigallocatechins from green tea, it killed the virus on contact. Please allow me to introduce myself. My name is Mark Johnson. I'm here to share with you an exciting new, technologically advanced, patent-pending green tea hand sanitizing wash from Handout Protection. Now, this is not your typical hand gel designed to just smear all over your hand. This is a hand washing sanitizer to cover your entire hand, both the front and back of your hand, in between your fingers and your wrist. This is a non-sticky sanitizing hand wash designed for convenience to take with you in your purse, pocket, or carry in your lunchbox. As Dr. Josh Ridge has stated, what goes on your body goes into your body. That is why we choose only the highest FDA-compliant ingredients, such as 75% isopropyl alcohol in organic green tea brewed with alkaline water. The only way to protect yourself and your family is to always carry a disposable package of Handout with you. This may be the only handout you ever need.
Hi, this is Dr. Lenore Coleman. Welcome back to For Your Health. As you know, I'm the president and founder of Healing Our Village and Total Lifestyle Change. And every Saturday, we bring you For Your Health. This month is the month of April, so we're going to be talking about health disparities and about conditions that affect different African American, Latino populations. And today we're going to be talking about the medical uses of CBD. We have with us Dr. Marilyn Corder. She hails out of the DC area, and she's a pediatrician, geneticist, my longtime friend and travel buddy, and exactly. And so we've been doing. We're warriors. We're warriors in this in health disparities and trying to heal the village. And thank you, Dr. Corder, for being here today. We were talking about all the good reasons why CBD is something that you should consider if for certain disease states. I want you to talk about your company. You actually have the products. You have some of them actually there, so you can show folks. Maybe we can talk about how you dose it and what you use those various products for, and then a little bit about the company, how they get to your website, and also this is an opportunity. It's what we call social enterprise. This is an opportunity to actually start a business, right? So I want to have you talk about that as well.
Well, it's interesting. I've already been in private practice for over 40 years, and I had no idea of CBD until recently. But let me just back up a little bit. We realize CBD hemp is in the Bible, as Dr. Gupta says, as Dr. Oz, I'm not giving them plugs, but truly. And we understand that this is something that for years have shown improvements. Again, it's just been on the back burner for various reasons. It's now out. About a year and a half ago, one of my patients came to me and said, Doc, and showed me a CBD item. Then 2 or 3 were coming out and saying, this has really helped this, it helped for that, migraines, etc., from the rubs to the sprays. And what do you think? So I'm like, you know what? I need to do my research. I need to understand and find a company that I can say, this is what I recommend. All CBD is not equal, as I said in the top of the show. And I want to make sure that whatever company that we're talking about has several things. Number one, it's made in the United States. It's made in an FDA lab. This is what our company has. each product has a certificate of analysis. A certificate of analysis, COA, people may not understand, but that means that each and every batch, you can trace it back. It's not made in my kitchen. It's not made in my basement, okay? It's made in a lab that you can trace back. As a physician who gives vaccines, etc., every batch we know and can trace back. It also has, and this is something that is rare, it has a date of manufacture called DOM. Now, most of the time you get a date of expiration. So you can go to the store, pull up Tylenol, and it may say it's going to expire in 5 years, but you don't even know how old it is already.
Right.
This has a date of manufacture, and I'm so impressed with that. Most of the things are 5 years or so. The date of manufacture, so you're using something within a month or two of manufacturing.
Right.
You talk about fresh. Like fresh, the loaf of bread. Okay.
Yes, exactly.
And your body is responding to something that's fresh. You could have almost grown it in your backyard, but you wouldn't have had the lab and the certificate of analysis. Right. Having said all of that, I said, okay, I'm going to now look into this company because I searched. It's in the top 4. It's called Oxygen. Now, it's funny because we need oxygen to live. But this is called Oxygen, spelled a little differently. So get your pen and paper out because I'm going to give you the website. It's called Oxygen. And to me, it helps you live more effectively in each and every breath because now your body is, as you said, now is in a state of anti-inflammation because many a time, not just obesity, but the things we use, the fake food we eat, our lifestyle, what the stressors are, have put our bodies in an inflammatory condition. And if you think of years ago with those, I call it the snow globe, you know, everybody's seen that, and you shake it up and you see all that stuff. That's how bodies in inflammation. We need it to settle and clear the air.
Yes.
And as we have that, this is what CBD does. And the endocannabinoid systems are from head to toe. I've had folks get pregnant. You know, I'm not a fertility, but somebody said, well, it helped me get pregnant. Within 2 months of using it, she said, I'm pregnant. I'm like, what? You know, I've had folks tell me about their inflammation, their IBS, their leaky gut. I've had folks, and I'm going to tell you personally, I just got my lab work back, and I'm going to be personal now. I got so excited. Throughout COVID, I did put on some weight. Unlike you, I'm proud of you, my sister, but I put on some weight. And I'm like, okay, I had to update for my life insurance. I'm like, oh, God, they're going to tell me about this, tell me about that. And they do all the labs because they want to make sure you're not about to croak. I'm not about to die. Okay. So I had the lab work done. I'm looking at the girl as she's drawing my blood. I'm like, oh, well. Then, you know, you can go on the website. They tell you, here's your lab. My triglycerides were just 100, which is half. My hemoglobin A1C is all normal. I was pre-diabetic before. Getting older in age, in my 60s, being an African-American descent. So it's like, I knew it was going to be borderline. It has never looked so great. And I hadn't had labs in a year. But you know the difference? In 1 year's time, I've been taking the CBD drops. I've been taking something called Immune Boost. And I'm going to tell you about that in a few minutes. Because that's the only difference. Because otherwise, I've gained my weight, you know, but it's CBD. And I'm so excited. I just got the results back on Thursday. 2 days ago. So I'm going to print it. It's like frameable. But they checked everything. They checked to make sure you're not anemic. They checked and there's something called inflammatory conditions that your heart has. They checked those. They want to make sure you're not about to have a heart attack. Those were perfect, as if I were 18 years old.
Wow. I love it.
The liver functions, the kidney functions. Yeah. And my cholesterol is 150. That's like a baby. So I don't exercise. I have to put my head down. I don't exercise. But I'm going to. I got excited. I'm like, wow, if I could look this good with just CBD, now I'm going to do the right thing because I'm going to tell you, doctors, as you know, we say, do as I say, not as I do. I'm going to be telling you guys right here, Facebook Live, do as I do as I take my CBD. And I'm now going to do all of the right things because it's just incredible. I feel great. As I said, I'm taking it because, you know, it's preventive and it's so important. So the company is called Oxygen, OXZGEN.com. And I'm going to give you my website. So OXZGEN.com / L as in love, 1442387. Now, when you pull that up, and I'll repeat it, when you pull it up, I want you to put a P behind the 7. That's because I love Dr. Coleman and her audience. That gives you preferred pricing of all of the products.
Thank
So
you.
I'm going to repeat it. oxzgen.com /L1442387 little p. I'm also going to give you my website. My email is dr as in doctor, and you put a period behind it. So dr dot the number 4 teens teens at yahoo.com. So if you have any questions, that's dr.for-teens at yahoo.com. I invite you to ask me, to allow me to help you become a better you from the inside out. You know, this has helped people's vision. I've had folks who tell me they were about to have surgery. My mother-in-law, she had glaucoma, and the doctor was checking her pressure and then said, come back, because it was borderline high. She came back, it was like half the amount. It was as if she had new eyes. He said, what did you do? What are you taking? And she said, nothing, nothing. And then she said, oh, my son sent me some drops in the CBD. So, you know, I invite folks to get their lab work done if they can. I know it's COVID, but if they can get the lab works done, all of the parameters, take this for 3 months
And
or
see
so
if
and
there's a
repeat.
difference.
Then see if there's a difference.
Tell me how many
Because-
drops. That's what I want you to tell me.
Okay, so yes. Okay, so it's also anti-cancer. I had no idea inflammation causes cancer, but
Yeah.
over the past 10 years, we see that. There's even an association of obesity causing cancer.
Yep.
Some of my colleagues, my oncologists say, yeah. So obesity, inflammation, all that changes the cells. And we know CBD shrinks cancer cells and gives you your fight back, as in terms of immune boost. So, and all of that. And you know, one other thing, and I'll get back to one other thing, people say, well, it's not free because my doctor writes prescriptions and my insurance pays for it. And you're right, it's not free.
No.
But how do you value your life? How do you value? So you may not be able to get your nails done or your hair did, okay? Or even cut back on whatever you're doing excess. It might cost you $70 a month or $150, but isn't your life worth it to be around? And we have the immune boost, and I don't leave my house without it. So I start my day, we have CBD coffee. I have the hazelnut CBD coffee, immune boost. We have the spray if you have pain, but we also have the pain free. So many people love this. We have the creams, and you'll see it and get your discount. But so you ask the dosage. So any child and from age 8 on, 60 pounds at least, we have the CBD drops. And that goes sublingually under your tongue. It's 1 dropper full, a little bit, and this is a month's worth. And you put it on your tongue, wait for about 10 seconds and swallow it. Patients love it, no matter how picky your taste buds are. And we see that, and that's the dose that would be 20 milligrams, which is a dropper full of the smaller bottle. Then those who have something called lupus, autoimmune conditions that are chronic, rheumatoid arthritis, we ask them to use the 1,500 milligram 1 dropper full, which is equivalent to like 40 to 50 per dose, a dropper full. I'm seeing folks with MS. I'm seeing folks, and they're like, and I'm just giving it. Yeah, you can make money as a business opportunity, but I'm probably breaking even if I'm just handing it out because I'm doing my own study and research, and it's worth it.
Right.
And when they come back, I just tell them, go on my website. I give them the discount, the P, because right now, I just want us to be our own navigator of ourselves.
Right.
I want them to understand, especially the seniors, especially folks who are not so empowered, but I want to empower their bodies and their health and spread the word. We have folks from 8 years old to 99 to 100 giving us testimonies after testimonies. I have folks who say they like their teenagers now. They like their wives. You gave me back my husband. You gave me back my child. You also, those that are taking care of their seniors, you gave me back my loving mother who's
Right.
not in the middle of the night screaming. Because
Yes.
one thing, and I did not realize this until I started doing more CBD information and spreading the word, many people can't sleep, Dr. Coleman,
Yeah.
have sleep problems, insomnia.
Insomnia.
And then when I realized, I went to As I went to the drugstore, you see all these sleep aids.
Right.
Oh my God. Over-the-counter sleep aids are addicting. Sleep aids. It aggravates everything. Not to mention the prescriptions that the folks have to get.
Right.
So we have sleep gummies.
Yeah.
We have sleep gummies that have melatonin and little CBD, and I'm telling you, that is the hottest, the most. Whew, it's to me, other than the drops and the immune boost, the needed, because with the pandemic, people are anxious about everything. Am I going to get it? Who has it? With all of the masking, et cetera, that we have to do, and they can't sleep.
Right. Right.
And
Now, what's
their
inside
relatives
the
can't sleep.
immune? To cut you off.
Well, wait,
What?
so the sleep gummies, one or two gummies,
One or
I'm
two.
looking for, I
Okay.
never have enough. One or two gummies right before they go to bed, and people wake up and say, wow, I got real sleep.
I
They wake
know.
up refreshed. They wake up ready. Several, I'm thinking, I can't stop but smiling. I'm thinking of one particular friend of mine who's a clinician, and she's taking care of her mother. She said, I got my mom back. She wakes up, what's for breakfast? As opposed to screaming all night and no one's slept.
Right.
And she's waking up, and I call it refreshed. So, what's in the immune boost? Okay, here we go. The immune boost, we have vitamin D, D3, which we know we need. We have zinc. We have glutathione. We have CBD. We have all those natural things that, in and of itself, you can hardly find in the health food store. But it's all blended in one tablet, and I take it every single day.
Yeah. So
And you'll be able
what's in
to
the
find it.
immune boost? I wanted to hear what was in it.
Vitamin D3,
Okay.
zinc,
Okay.
glutathione,
Okay.
CBD,
Okay.
holy basil. And there are things, of course, I see you smiling because
Yeah.
many of my naturopathic doctors say, oh my God, all of that is in one
Yeah.
capsule.
That's
And that's
important.
why I like this company, because they get it right. They
Yeah.
get it right.
And the zinc, is really important right now because of the COVID, right? Because it's
Right.
important and there's clear evidence that zinc does make a difference. So, in fact, they were even using that in some of the hospitals,
Right.
as
Exactly.
for hospital treatment. So, I just think that I was impressed with the product line. Of course, as a pharmacist, I really wanted to know about safety,
Right.
efficacy, testing, and that what you say is in the bottle is in the bottle. That to me is what is so
Absolutely.
critical, because there's so many
Absolutely.
products out there that are not good, and they're claiming things that they're not in. There's no testing. They're not in FDA approved facilities. The
Right.
manufacturing's not done, and so I thought this product line was a good product line. I talk to people all the time. As you know, I do a lot of entrepreneurial things with Healing Our Village, and a lot of what we're doing right now is not covered by insurance. But my
Right.
question is this: so how much does the funeral cost?
Oh, you going there, right?
I'm
You're
going
right.
there. I mean,
That's
I
right.
don't know the last time y'all done priced a casket, but I just want
Right.
you to know that,
Right.
when you took my village club, for you to be able to have consultation, concierge counseling with my doctors and pharmacists and nutritionists and educators and life coaches is $60 a year. And people say, oh, that's a lot of money. Really? Okay. I'm about to come up with a brand new app that's going to be on your phone for diabetes prevention. It's called Step Up 90. It's going to cost $4 a month or $6 a month. And that's less than you're spending for your coffee when you're driving through, folks. I don't know what coffee place, what coffee place you're going through, but if you're ordering a Venti or a Grande, you paying more than $4. Okay.
Right. Right.
I just want you to know. So, Dr. Corder, I really want us as a community. This is April. It's Health Disparities Month. I want us to get in the game here, to take control over our life and our health and our families and our finances, because we're living in some perilous times. I'm in ground zero here in Georgia. They've already signed the voter suppression bill. It's done. Okay. We have got to, as a community, start to taking care of ourselves. We have to, right? The whole thing with George Floyd, and guys, I'm sorry, but I'm old. I'm old now, so I don't shine it up, spin it around. That whole thing with George Floyd started because the poor cashier saw the $20 bill and reported it to his boss because, now wait, they may take the money out of their salary if they take a bad bill. So this poor young guy didn't want to lose his job. So now when he was on the stand, he says, every day I regret. He almost broke into tears. If I
Yeah.
only hadn't reported the 20. Yeah? So we have got to try to take all of this stuff that we're doing. We got to reflect on it. And let's try to see if we can do a little better with our health, with our wealth, with our families, so that we can live the kind of life we're supposed to live, Dr. Corder.
Yeah. Yeah, it's like the perfect storm. The lifespan of folks of color is now have decreased because of the pandemic, because of the economics. COVID is now the number 3 cause of death. Hypertension in African Americans. And unfortunately, we're vitamin D deficient.
Yes.
We're zinc deficient. We have the comorbidities that adds to the risk factors. When we're in the hospital, we don't do the greatest. We don't get there till we are so affected. So all of that, to take CBD, in my professional opinion, is going to help whatever that condition is going to give you preventive. And you'll see, it will allow you, as you do talk to your doctors, because I want to respect the field of medicine and physician, to let them know how you're feeling. Many doctors now are learning about it. Probably 2 or 3 years ago, a lot of them, I'd say most of them didn't know. But I know now in Washington, D.C., in order to get recertified and your licensure, you have to take a class. 2-credit class physicians have to now take on the benefits of CBD.
I love that. That's super. That's super. Okay, so
Okay, because
listen,
we know.
I need you to say that website one more time, slow, so everybody. Okay, folks, get out your pencil and paper. Okay, say that.
Because I'm gonna give you the benefit, right? Okay, you ready? Again,
Yes.
it's oxygen spelled a little different. So it's oxgen.com/L1442387. But put a P behind the 87. And if you have a question and you're like, look, I didn't get that, just email me, dr.4teens@yahoo.com. That's DR and a period behind the R, the number 4, TEENS, like teenagers, but teens at yahoo.com. It is truly an honor, Dr. Coleman, Sister Lenore, to be your guest
Yes.
here at Healing Our Village. You have done so much for not just the DMV, not just ATL in Georgia, but nationally and internationally. Every time I mention Dr. Coleman, they're like, wow, do you know her? I'm like, oh yeah, I just have her on speed dial. She is
Well,
my
thank
buddy.
you. Thank you. I'm serious about healing the village. This is not just a cool name. And you're going to promise me to come back, right? Because
Oh,
I want to
absolutely.
talk about some of the other stuff that I know that you're doing that I think is amazing. And so, but I wanted to at least talk about the CBD. Listen, if you guys didn't get that written down, call our number, 800-788-0941. We will get back to you with all the information that you need to get in contact with Dr. Corder and make sure that you're able to get to the website. And I just, there's a beautiful ad here that you can see. This is actually the website that we're showing. So this is where we need you to go. Listen, take control. Take control. I had a patient who had ended up in the hospital because of diabetes, newly diagnosed. Blood sugar was 600. He weighs 400 pounds, and he's now on insulin. And so I've been working with him. And one of the things that the first conversation I had with him is I explained to him that I was going to work with him for the next 2 weeks, but he had to call me. I wasn't going to be calling him. If he wanted my help, he had to call me with his blood sugar so I could figure out what to do with his eating, etc. I told him he was the captain of his team. You are the captain
Yeah.
of your team. I am on the team, but I am not quarterbacking this thing. You are quarterbacking this thing. You have to direct this. I'm here to help you with that. So everyone out there has got to take control of your health. You know what you're eating that you shouldn't be. You know what you're drinking that you shouldn't be. You know what substances you're using that you shouldn't be using. So let's just get this thing together. This is 2021. This is our year. I want us to
Right.
reclaim our health and our control over our destiny. And so that was why I decided to do For Your Health. And I thank you so much for coming on today. And we're going to have you back, I promise.
All right. I look forward to it. And thank you again. And it's empowering. Remember, knowledge is power. And as much as I can inform and give the knowledge about how your body works, then I'm grateful to be able to empower you. Thank you,
All right.
Dr. Coleman.
All right. Thank you. Take care and enjoy your Saturday.